And so let me thank the ARC leadership, Dr. Prashant and the ARC team for this invite. And it brings me, after hearing Devakan's talk, it's my turn now from the LDP side, on the other side as a LDP alumni, and now as the president of Tamil Nadu Ophthalmic Association. But this talk is not about that. This is about entrepreneurship in ophthalmology. So we keep hearing this. Right. So why pursue entrepreneurship in ophthalmology? I'm sure most of the LDP alumni will have this question. Right. So somebody is doing a wonderful job in an institution. Somebody is stuck to a teaching institution. Somebody is stuck to a job in an NGO hospital, or somebody is like Anurag said, procrastinating about decision making on whether to switch over to entrepreneurship. So why do we need to pursue entrepreneurship in ophthalmology? So what exactly is this? An entrepreneur is one who has an idea. So this idea may work or may not work, but he has to take a decision when to make that idea work. He needs to have that skill, knowledge, and also strategize for it. And then he need to jump onto the leadership bandwagon to enter into this race, entrepreneurship race. So there are a lot of gaps in patient care or technology. Like Anurag said, there's a lot of technology innovations waiting. And also gives one's fulfillment. So many of us, when we want to become doctors, there is an inherent tendency of helping people. So it may be in social aspect, maybe in the medical aspect, maybe in some aspect where you need to touch people. So entrepreneurship can lead to this personal growth, fulfillment, and ability to directly impact patient lives positively. So it's not only having a clinic and running a practice. So this evolution of an entrepreneur starts from childhood, not in medical colleges or not after that. So what you want to become, so this journey starts quite early in many of us and may be guided or reflected in the later part of life. So what are the opportunities available in ophthalmology? We always think in terms of hospitals and a few things. So let me say there are a lot of opportunities in ophthalmology now. So one is technological innovation. So there's a lot of innovations coming up. And now it's a wonderful time for the innovations. Hubs are proliferating across the country. There are still unmet needs. So given the complexity of our Indian demographics, there are a lot of unmet needs with reference to ophthalmic care. And improving patient experience. So you see corporate chains bringing up with aesthetic centers, focusing on niche areas, and digital health integration. So this is happening in a big way. So not only related to the insurance, but also every part of patient record keeping and using AI and deep learning into the digital health integration. Research is coming up in a big way. And also social practice, social impact and sustainability. And entrepreneurs are the one who create jobs for the country. This is very, very important that so when we are developing or going into this entrepreneurship mode, we are not only feeding our family, but we are also feeding at least 40 to 50 families in a single eye care center. So this is the important aspect of one becoming an entrepreneur. So how do we start this? So one is clinical entrepreneurship. So we can start your own clinics, hospitals, or private practices, or in specialized clinics. So or within the department or existing hospital, you can start your setup. So a lot of health tech, digital health entrepreneurship is happening. So there's a lot of scope for it. So we now have new technologies, new apps coming up, and there's always tele-ophthalmology platforms. A lot of such platforms are coming up. The third is the medical devices and equipment. Some of us are very, very keen about what is happening inside the device rather than using that equipment. So that it depends on your mindset. So you can start working with designing, manufacturing, and selling new medical devices and equipment, creating advanced surgical instruments. I think my friend Suvan can speak about this for so many hours. like he developed a BX device, which changed the scenario for small pupil surgery. There are wearable devices that assist with vision correction. Now it's coming up. So previously it was very high cost. Now it is the affordable cost. Then we have this pharmaceutical and biotech and entrepreneurship. So you see the number of anti-VEGFs coming, number of injections coming. So these are drugs that is going to help and revolutionize the eye care therapy. So not only for posterior segment, but also for anterior segment, particularly dry eye. And so a lot of simulation techniques are coming, surgical training platforms. So these are educational and training ventures. And then social entrepreneurs. So a lot of such social entrepreneurs. India has been a wonderful playground for social entrepreneurship. So one is the largest eye care system, the Arvind Eye Hospitals, then Shankara Eye Hospitals, who has LVP is another different model. So many initiatives have come in this aspect and giving a lot of job opportunities as well as satisfaction to the government as well as to the people. And of course, e-commerce, you see, go to any town, there is a lens cart or specs makers now. Okay, so instead of somebody non-medical person thinking, the ophthalmologist can think of it, can bring that medical angle to the e-commerce segment. And so this is also one aspect. And then, of course, the health services and solutions. So these are businesses, chains or hospitals, so which can offer solutions that are not only medical, but also non-medical. So these are so many opportunities available for entrepreneurs. But why for ophthalmologists? So basically, we all know we have the important physician task known to us, taught to us. So there's 2 F's. So what we need to do is find it and fix it. What is the problem? We need to give a solution. So all entrepreneurs are problem solvers. So we have to find the right problem and see how we can give a solution, whether it's an improvised solution or a new solution or a new innovation. So, and there is always 2 voices among the patients. So physicians have this voice. We need to understand this. So we want to quickly go into the history, examine, and then give a differential diagnosis and start giving the treatment. But patients have a different voice. If we listen to this voice, we'll make the experience for the patient in a better way. So this is how practices can differentiate. So patients want to tell their story. They are concerned with your personal interaction and want your response for the open-ended questions. So I'll briefly touch upon the important aspect, patient satisfaction, why it is important in your clinic or hospitals. So that is where excellence is not being the best, it is doing your best for the patients. If you can focus on this area, your entrepreneurship will be successful. So there are a few questions you need to ask in clinical practice or from the patient perspective. So these are actually the mysteries of the medical world. If you are able to solve these mysteries, if you are able to solve this problem, you are halfway through in the success journey. So what are you doing for me? So this is the patient's primary question. Why are you doing this rather than that? What are the options? You given a differential diagnosis, what is the option for treatment? Will it hurt me or harm me, both physically and purse-wise? So how much and how long I need to spend? And when and how will you know what all this means? So what would be the end result? What would be the outcome? So if you are able to give this as a clinician, as a practice owner, as an entrepreneur, then the customer or the patient base is going to increase. Right, so I'll just give you some points. So it's all about word of mouth. Even in the digital time, it is still the word of mouth. So if you satisfy one patient, 4 new patients come. But if you disappoint one patient, it reaches 10 potential patients. And now with social media, it's going to be at least 1 lakh patients. So your negative news becomes more viral. And it is a lot more than clinical outcomes. So we always focus on 6 and those things. But patient clinical outcomes or their experience is not based only on this outcome. So how they were treated in the hospital, how they were given a prescription, how they were explained about the prescription, all these matters. So being young ophthalmologists, so this is very, very important when you are going to set up your entrepreneurial journey, understanding the patient perspective and seeing this from his shoes. And they are willing to switch. We have to understand this. However good you are, however you have a big practice, however your reputation is there, patients are willing to switch for better if they find there is an alternative. So this is the reason why 77% of patients are willing to change their brand just by hearing that there is a better service provider. And then what's special about good service quality? Most of this have a good story to tell. So you have to ensure our patients, when they leave our practice, have a story to tell others. So this is where patient touch points makes a difference. A satisfied person has no story to tell. Whereas a loyal customer, there is usually a special story. So we need to make every patient a loyal customer or loyal patient rather than just providing service. And you need to measure. This is my favorite slide. Unless you measure, you can't manage, right? And what is that? So only in the top two, you see the green area, 9 and 10, these are the satisfied patients who are going to tell your story. The rest will not tell anything about your practice. In fact, the less than 6 points, they are going to tell negative opinion about your practice. So if you are entrepreneurs, you have to know this customer profile and patient experience. And patient experience, of course, sustainability and outcome in terms of finance is also important. Your bottom line is important. And when the patient satisfaction is high, the bottom line will grow. This is not beyond satisfaction. Very often we tend to focus on Google surveys or other surveys, but it doesn't give much of a thing. You need to concentrate on individual patients so that over a period of time, the numbers are good. And it is, as I said earlier, it's a lot more than clinical outcome. If you go through many of these surveys, that gives how well staff training and staff orientation to the requirements of patient is very important. Having all this, so these 4 E's are very, very important. So whenever in your practice, you need to engage the patient, empathize with the patient, put yourself in the shoes of the patient, educate the patient. Of course, counseling is, now we have relegated that to counselors. We need to take it up and enlist the patients. So we need to focus on this service quality to become a good entrepreneur. So a mind of an entrepreneur is always in a flux. You need to identify challenges, overcome challenges, and we all know about the success stories of many entrepreneurs. I may not go into this. And then call to action. So don't procrastinate. Take an action and take the first step towards entrepreneurship. By identifying a problem you are passionate about solving. So if you identify this problem, you can give a better solve. And leadership is not only about undertaking a course. You need to focus on the customers, that is patients. And of course, if you make them delight, patient delight, and then build your team to give them good experience, you can be a good entrepreneur. The essence of entrepreneur is a balancing act. So you have to take up that balancing act. Thank you so much.